Now, hereditary breast cancer, majority of the time women ask me in my clinic, I don't have any family history. I don't think I'm going to get breast cancer, but that's not the case because the chances of hereditary genes causing breast cancer occurs in only a very small number of women. 5 to 10% of women who get breast cancer will have hereditary genes. Of course, familial risk, if there is a mother or sister with breast cancer, the chances of one getting breast cancer remains high. But majority of the time, women get breast cancer because spontaneously the genes that they have in their body goes through mutation for unclear reason, and that's what causes breast cancer. So if one were to carry BRCA or hereditary gene, their chances of getting breast cancer can be as high as 65 to 70% based on their age. But it is not just about getting breast cancer. They also stand a high risk of getting ovarian cancer and now pancreatic and colon cancer, and in men, prostate cancer as well. So it is beneficial to check for hereditary genes when there is a suspected risk. Now, there are some non-cancerous findings in a breast. When a woman gets a mammogram and they find something abnormal and they get additional imaging, whether it is an ultrasound or an MRI, and that warrants them to get a biopsy. So these are some of the findings you may see in a biopsy, which does not mean that it is cancer. So if one has cysts or something called fat necrosis, or something called slightly enlargement of the cells, mild hyperplasia, they don't affect breast cancer risk at all. They are definitely not at a risk for causing breast cancer. On the other hand, if we were to find things like ductal hyperplasia, what does that mean? It is nothing but overgrowth of the cells that lines the small tubes inside the breast. So in such condition, there is excessive growth of cells in the ducts, but they don't look abnormal. These conditions may tiny bit increase the risk, but not of great concern. If there is a fatty tumor called fibroadenoma, that is not a risk for breast cancer, or sclerosing adenosis. These are some terminologies, if one may see in the report, they don't really increase the risk of breast cancer. Maybe tiny bit depending on what one finds. Whereas on the other hand, if we were to find these terminologies in a pathology report, in the past, not much attention was paid to them, but here the cells that are lining the tubes or the ducts in the breast, they grow excessively and some of them begin to not look anything normal. So the risk of breast cancer in such condition, if one were to have, increases by about 4 to 5 times higher than normal. So if, on the other hand, if there is more than one risk factor, for example, if a woman has on a pathology report atypical ductal hyperplasia, and there is a family history of breast cancer, well, their chances of getting breast cancer is even higher. So it makes sense to take some precautions and preventative measures in such case. Now, what are some of the preventative measures one can do in order to reduce the risk of breast cancer? Besides the fact that majority of the risk factors are not modifiable and it's beyond our control, but there are some risk factors where we can definitely take into hand and try our best to control getting the risk of breast cancer. So there is increasing evidence now that overweight or obesity increases the risk and recurrence of breast cancer. And so thereby it is recommended that one should be physically active, exercising at least 30 minutes, 5 days a week with moderate intensity. And that has been clinically proven to reduce the risk of getting breast cancer. And the other things, of course, now awareness has come about that women at menopause should not be taking any kind of hormone replacement treatment, which has shown to increase slight risk. Avoiding alcohol and so on are some of the preventative measures one can take, which is in our hands to prevent breast cancer from happening. It's also very important to spread the message that these are myths on breast cancer and not reality. So it doesn't mean that if one is young that they don't get breast cancer, although it's not very common, but it can happen. It also doesn't mean that if nobody in the family has breast cancer, one will not get it, or doing a mammogram or a biopsy or surgery will cause cancer or tumor to spread to the air and further spread elsewhere. That's totally a myth. Using deodorants does not increase the risk factor. And likewise, the other myths that I mentioned here, I do have women saying, oh, I shouldn't be eating any sugar or meat or whatnot because my cancer risk increases. It has really not been proven to increase the risk of breast cancer at this time. So here's the anatomy of breast tissue here. As you could see, it's primarily made up of fat tissue, and then you have these grape-like structures called the lobules. That's where the milk is made, and the milk flows through the ducts, which comes out through the nipple. And cancer happens within these ducts majority of the time, if it were to occur. Sometimes it can happen in the lobules as well. And the breast tissue is supplied by lymphatic drainage, which is our immune system, and it drains all the lymphatic juices. And there's a chance for cancer in the breast to travel to the lymph nodes, and that's how it can spread to other parts in the body. It's also important to teach a woman to do self-breast exam every couple of months or so. It is not a substitute for screening mammograms, but it creates an awareness to bring it to the attention of their doctor if they were to find something abnormal. So there's a technique in doing self-breast exam. It's better to stand in front of the mirror with your arms down and by the waist or hip, and then using the fingers of the other arm in all these motions that is shown in the graphic cartoon here should be used in these patterns to detect anything abnormal. And the same should be done lying down position, and not to forget checking in the armpit area for any abnormal findings and to bring it to the attention of one's doctor. So another thing to create awareness is to bring it to the attention of one's physician about any changes in the breast, whether it's a discharge from the nipple, whether it might be clear or bloody discharge, or whether there is retraction or inversion in the nipple. It may be abnormal, and that needs to be worked up further. Also to create awareness in women that if they find a hard lump in their breast, if they've noted swelling or redness or increasing warmth, if there's a drastic change in the size of their breast tissue, if they note some puckering or dimpling of the skin, anything that's itchy or scaling, or a pain that may not go away, to please bring it to the attention so that further workup can be done and cancer, if at all, may be picked up in its early stage. Now, there are different types of breast cancer. Most often cancer happens within the ducts, and that's why it's called a ductal carcinoma. If they are superficially present, it is referred to as in situ or ductal carcinoma in situ. But if it has invaded the deeper glands in the breast tissue, it's called invasive cancer. Likewise, if it happens in those grape-like structures, it is referred to as lobular carcinoma. And there is a special entity called inflammatory breast cancer. Fortunately, it occurs in a very small number of women, and here's a condition where the skin of the breast gets involved with cancer as a part of direct extension. It is a very aggressive type of cancer and difficult to treat as well. One of the concerns if breast cancer is picked up at a much advanced or later stage is that it may spread to other places. And typically, if it were to spread, it loves to go to the bones in any area in our body, or organs like the liver or lungs and even the brain. So we want to avoid getting cancer spread to these places and want to pick it up sooner. And also in its early stage, give them an appropriate treatment so that we avoid causing a recurrence or spread at a later time to these places. Once one gets diagnosed with breast cancer, we stage cancer. There are 5 stages, stage 0 to stage 4, based on the size of the cancer in the breast, whether it's spread to the lymph nodes in the armpit area, or if it's spread to distant places. That's how the staging is made. And staging helps determine appropriate personalized treatment for a woman with breast cancer. And obviously, earlier the stage it gets diagnosed, better is their chances of remaining free from cancer in the long run. In general, an overview about treatment for breast cancer depends on many factors, whether it is one's age or the other medical conditions or their preferences. But in general, it requires surgery, chemotherapy, radiation, and estrogen hormone blocking medication as well. So I want to end at this saying that it is extremely important to also recognize one's emotions once they are diagnosed with breast cancer and to pay attention to that, because mental health is really huge in this day and age. And I encourage to continue to foster a community of collaboration, inspiration, and health awareness to improve outcome of women's health in India as well as all around the world. So please join the fight and save lives, support family and friends in their breast cancer journey, either directly or through various community programs, because together we can achieve a lot. And thank you very much for inviting me again.